So testing and programming in lower back pain, same as with arthritis, but watch as pain allows. Strength, flexibility, functional, especially if people need to do a return to work. Aerobic exercise, muscle strength. Again, core muscles. We can't emphasize that enough. Actually, the Kirkley et al., that's the study on the knee arthritis, so I should not have put that one in that spot, but that is another example of where they've used exercise and physical therapy instead of surgery. Coordination and balance, so you know about that, neuromotor training, flexibility training, so especially focusing on those core areas. Osteoporosis. So 10 million people have osteoporosis, but 34 million have what's called osteopenia, or low bone mass. So again, so they're not quite, just like pre-diabetes, you don't quite have osteoporosis with osteopenia, but you're on your way. So typically when they do the DEXA scan, so they are at least 2.5 standard deviations, so remember your research methods, below normal bone density. There are 34 million people at risk of osteoporosis. Genetics is a factor, lifestyle factors, hormone influence, nutrition, calcium, and vitamin D. And of course, as we know, can lead to costly fractures. And of course, sometimes with some people who are very frail with low bone density, they may just have a spontaneous break and then a fall. But of course, falls can be very serious, especially in older adults, and so they can lead to many other problems with older adults. And that, if they have a fall, it tends to set off other cascades of injuries and increases their risk of mortality from other problems. As you know, with bone, the different types of bone, your cortical, your compact bone, so that is in the shaft of the bone, the trabecular or the spongy bone. If you look back to those slides at the beginning of the class, your spongy bone, most of us know the difference. Again, make sure you've got your osteoclasts and osteoblasts straight, osteocytes. And so peak bone mass occurs at about age 30. I know we've covered that with the youth resistance training. And so as we get older, we have more reabsorption than formation. Risk factors for osteoporosis, as you can see, pretty common list. More common in females, but it does occur in men, as we talked about that, like medications. You could also add in cancer. Say, for example, if a man has undergone prostate cancer treatment and he is on medications to suppress testosterone, he can also be at risk of osteoporosis as well. So, postmenopause in women, smoking also affects bone density. Caucasian or Asian races have a higher risk, so a little bit less risk in African American populations. We talked about medications, diseases, of course, anorexia, bulimia because of not proper nutrition, and cystic fibrosis. So pretty common risk factors, and but can affect men as well as women, but women mostly. Calcium and vitamin D. This is really important. Adults should get 800 to 1,000 milligrams per day. So that's about 2 to 3 dairy servings a day. And for those older than 60, if someone's going to take in calcium, or if they're going to take a supplement, take in about 500 milligram doses, because that's the most that is going to be absorbed at one time. So you can't just take a bunch of Tums and think that's going to be good for your bones. You need to take, say, look at the large dose of Tums. If you've got 1,000 milligram Tums, then you have to take half of that. Vitamin D, as we talked about with older adults, getting some 10 to 15 minutes sun exposure every day, which can be a challenge, so because especially people have been told to avoid the sun due to skin cancer. As a result, there are more and more people who are vitamin D deficient. And especially people middle age, older adults that live in nursing homes, So most people are going to need a supplement of 2,000 international units per day. So that is very important, for bone health. And vitamin D has also been associated with risk of certain cancers as well if you've got low vitamin D. So we're really only learning a little bit about vitamin D.